In a hospital in Shanghai, doctors put on animal masks so nobody could recognize them, then diagnosed a patient the normal way, reading scans, arguing, cross-checking for 13 minutes. 2 AI systems built in China got the exact same data. They answered in under 2 seconds and matched the doctor's diagnosis exactly. Nobody outside that room believed a Chinese AI could do that. But the Shanghai Showdown wasn't a fluke. It's one entry in a stack of peer-reviewed results that explain a number that sounds made up. AI running inside 9 out of every 10 hospital provinces in China. That headline you've probably seen floating around, the one that says a Chinese AI now outperforms every doctor on Earth, isn't exactly true. No single system beats every physician at every task, and anyone telling you otherwise is selling you the poster, not the study. What actually happened is stranger and more useful than the poster. A handful of specific, verified, peer-reviewed Chinese AI systems have each beaten specific groups of specialists at specific tasks in real hospitals on real patients with the published paperwork to check the claim against. And once you see how many of these wins have stacked up in just the last 3 years, you start to understand why hospital systems on the other side of the planet are watching China's healthcare AI roll out the way generals watch a rival's new weapons program, quietly and with growing alarm. The Shanghai Showdown itself is worth slowing down on for a second, because the AI in that room wasn't some general-purpose chatbot improvising its way through a medical exam. It was a purpose-built system called the Gastrointestinal Multimodal AI, trained specifically on 30,000 real patient cases, pulled from gastrointestinal medicine. The kind of narrow, deep training that lets a model learn the specific visual patterns of one organ system better than almost anything else could. The doctors in the room wore animal masks, so nobody watching could accuse the hospital of picking friendly physicians or staging a soft comparison. Both sides got the exact same imaging, the exact same patient history at the exact same moment, and the AI still delivered its full diagnosis and treatment plan before most people could finish reading this sentence. Start with the win that's hardest to argue with, because this one is a real diagnosis, not a simulation, and not a stage-managed demo. The disease at the center of it usually kills before anyone notices it's there. Pancreatic cancer has one of the worst survival rates of any major cancer, mostly because, by the time a patient feels sick enough to get scanned, the tumor has usually already spread past the point where surgery can help. Doctors call it the silent killer for a reason. Radiologists have to catch it on a CT scan before it ever causes a symptom, and on a plain, non-contrast scan, the kind hospitals run by default without injecting dye into a patient's veins, a small pancreatic tumor can look like nothing at all. It hides inside an organ that already looks lumpy and irregular on a normal scan, tucked behind the stomach where even a trained eye can miss it. Alibaba's research arm, DAMO Academy, built a deep learning model to solve exactly that problem. Lilu, the head of DAMO's medical AI team, and his group trained it on abdominal CT scans from more than 3,000 confirmed pancreatic cancer patients, then built a fully automated segmentation system on top of that data using transformer-based architecture to map the pancreas and everything around it, down to the millimeter. They named the finished model Panda. In November 2023, they published the results in Nature Medicine, one of the most selective medical journals in the world, the kind of publication that doesn't let a paper through without the numbers holding up under outside scrutiny. In a real-world validation study spanning more than 20,000 patients across multiple hospitals, Panda hit a sensitivity of 92.9% and a specificity of 99.9% at catching pancreatic tumors on those plain CT scans. Translated out of statistics, it almost never missed a real cancer, and it almost never flagged a healthy pancreas as diseased. Against the radiologists reading the exact same scans, Panda beat their average sensitivity by 34.1% and their specificity by 6.3%. That's not a rounding error. That's a real structural head start most competing labs are still trying to close. Here's where the number stops being abstract. Alibaba ran Panda through a hospital in Ningbo, screening 40,000 people who walked in with 0 symptoms, 0 warning signs, 0 reason to expect a scan that morning to change anything. Inside that screening group, Panda flagged pancreatic cancer signs in 31 patients whose own doctors had already looked at the same scans and cleared them. 31 people who would have walked out of that hospital with a clean bill of health, carrying a tumor nobody human had seen. In April 2025, the U.S. Food and Drug Administration handed Panda its breakthrough device designation, the FDA's way of fast-tracking a technology it believes could meaningfully change patient outcomes. That's an American regulator on American soil reviewing a Chinese-built cancer model and agreeing the numbers hold up. Also worth sitting with, an FDA breakthrough designation doesn't mean approval. It means the agency thinks the evidence deserves a fast lane instead of the standard multi-year review queue. That's still a foreign regulator, built to protect American patients first, looking at a Chinese model's raw numbers and deciding they were too good to make wait in line. So that's one AI, doing one narrow job, better than the trained humans doing that same narrow job. If China had stopped there, this would be a solid story about one good product built in one good lab. It didn't stop there. Across town from Alibaba's labs, researchers at Tsinghua University built something stranger, and honestly a lot harder to explain in one sentence. Not a single diagnostic tool, but an entire simulated hospital, populated by AI characters standing in for doctors, nurses, and patients, all interacting with each other inside a computer, running through cases nobody in the real world will ever meet. Professor Yang Liu, who co-leads the project out of Tsinghua's Department of Computer Science and Technology, calls it the Agent Hospital. Instead of training one model to spot one disease, the Agent Hospital trains AI doctor agents, the way a human resident actually learns medicine, by seeing patients, reviewing the case notes, getting some diagnoses wrong, reading the medical literature to figure out why, and trying again on the next simulated patient walking through the virtual door. The design behind it is called MedAgent Zero, and in the team's published results, the doctor agents hit 88% accuracy on examining patients, 95.6% on diagnosing what was actually wrong with them, and 77.6% on choosing the right treatment plan. Those aren't perfect scores, and the researchers don't pretend they are. The treatment number especially still has real room to close. But this is the part that should actually worry a human medical resident. The Agent Hospital can run a doctor agent through tens of thousands of simulated patients in a matter of days. A real human doctor needs roughly 2 years of residency to rack up that same volume of clinical experience. The AI isn't just diagnosing faster than a doctor standing in the room, it's compressing years of medical training into an afternoon, then doing it again the next afternoon, and the one after that, at a pace no residency program on the planet could physically match. Tsinghua's spin-off, Tyrex, had a public pilot of the system lined up to go live in 2025, with AI characters standing in for real doctors handling real cases in the wild for the first time. Compare that to how a Western resident actually trains, years of supervised rotations, capped at 80 hours a week under US accreditation rules, learning almost entirely off however many patients happen to walk through one specific hospital's doors. The Agent Hospital doesn't run into that ceiling because it isn't bound by a human body's need for sleep, a legal work week limit, or a single building's patient volume. Put those two stories side by side, and a pattern starts to show up that neither lab was necessarily trying to prove. One Chinese lab builds a narrow specialist that beats radiologists at spotting one specific, deadly cancer. A separate Chinese university builds a general-purpose training ground that grows diagnostic reasoning at a pace no human training pipeline could ever match. Different teams, different cities, completely different approaches to the problem, and both landing on the same result, AI outperforming trained physicians at specific measurable clinical tasks, verified in published peer-reviewed research rather than a company's own marketing copy. If you've watched this channel cover China's battery factories or its EV supply chains, this next part is going to sound familiar. It's the same playbook, aimed at a completely different industry. Build the narrow technical win first. Get it published somewhere nobody can dismiss. Then scale it nationwide before the rest of the world finishes debating whether it's real. Healthcare just happens to be the version of that playbook, where the stakes are measured in tumors caught early instead of factory output. The tell is always the same. A narrow win nobody outside the industry notices. A peer-reviewed paper that makes the win hard to dismiss. Then a rollout timeline that moves faster than any Western regulator's calendar allows for. Batteries did it over a decade. Healthcare AI just did the equivalent in about 3 years. None of this happened out of nowhere either. China's smart hospital push traces back to 2014, when the concept first showed up in national health policy documents, more than a decade of quiet infrastructure building, digitizing patient records, wiring up hospital networks before any of these AI models had anything worth training on. By 2025, industry watchers started calling it China's DeepSeek moment in healthcare, the point where a decade of infrastructure spending and a sudden leap in model capability collided at the same time, in the same hospitals, on the same patients. And then the pattern went nationwide almost overnight, which is the part that actually changes the scale of this story. In January 2025, a Chinese AI lab called DeepSeek released an open-source reasoning model, R1, that anyone could download and run on their own hardware. No cloud subscription, no vendor lock-in, no waiting for a government procurement cycle. Chinese hospitals didn't wait for a formal pilot program either. A nationwide cross-sectional survey later published on the research platform medRxiv tracked exactly what happened next. Within roughly 60 days of that release, 261 hospitals across mainland China had already installed DeepSeek locally on their own servers, spanning 93.5% of the country's provinces. 84% of those installations landed in tertiary hospitals, the highest tier of Chinese medical facility, the ones handling the most complex and time-sensitive cases. A separate study, published in the Journal of Medical Systems, confirmed roughly 90 of those tertiary hospitals had gone live by February 2025 alone, with some sites reporting a 40-fold jump in how fast staff could follow up with discharged patients. For comparison, American hospital systems routinely spend years just evaluating a single piece of clinical software before it ever touches a real patient chart, running committees, security audits, liability reviews, before a single doctor ever gets to use it on a real case. China rolled a frontier AI model into hundreds of hospitals across nearly every province in the country in under 2 months. Part of that speed comes directly from DeepSeek's decision to release the model as open source in the first place. No licensing negotiation, no per-seat subscription fee, no waiting on a vendor's sales cycle. A hospital's own IT department could simply download the weights and run the model on servers already sitting inside the building, which is exactly why a rollout that would normally take years happened in the time it takes most Western hospitals to finish the paperwork for a single new piece of equipment. At Ruzhen Hospital in Shanghai, one of the country's oldest and most respected teaching hospitals, doctors are now running roughly 3,000 pathology slides a day through DeepSeek, flagging which ones need a specialist's closest attention before a human even sits down at the microscope. This is a functioning tool sitting inside the daily workflow of one of Shanghai's busiest hospitals, chewing through a caseload that would take a pathology department far longer to work through unassisted. And because the model runs locally, inside the hospital's own firewall instead of on some company's cloud server, patient scans and records never actually leave the building. Nobody outside the hospital ever gets a copy of that data. For a country that watched Western tech giants build entire business models on other people's private information, that detail is exactly why hospital administrators felt safe installing something this powerful this fast, at a scale most Western health systems are still years away from even piloting. If you're finding this useful, go ahead and hit subscribe, because this channel tracks exactly this kind of story every single week, the breakthroughs almost nobody outside China is covering closely enough. Zoom out. And you can see exactly why regulators outside China have started paying close attention to all of this. This is an entire health system rewiring itself. Hospital by hospital, in public view, with the published data available for anyone to check the claims against. When American researchers went looking for a fair, apples-to-apples comparison, a study published in Nature's Scientific Reports journal in October 2025 tested a Chinese model called DAMO, built by ByteDance, against OpenAI's GPT-4 across a full simulated clinical workflow, 29 cases pulled straight from the Merck manual, the same reference doctors used to check their own diagnoses. The two models performed almost identically across every stage of the workflow. And buried in that same paper is something sharper than the headline comparison. GPT-4 had already been shown in separate published research to outperform human emergency room physicians working through the exact same style of simulated cases, which means the Chinese model had already matched a system separately proven, on paper, to beat trained emergency doctors at their own job. If you've ever sat in a waiting room for hours because the radiologist on shift was backed up, or waited weeks for a specialist appointment, because your city never had enough of them to begin with, this is the part of the story that actually touches your life. The bottleneck in healthcare has always been human attention. And human attention doesn't scale no matter how hard a hospital tries. The gap shows up fastest in emergency medicine, where a 5-minute delay reading a scan can be the difference between a treatable stroke and a permanent one, which is exactly the kind of task a locally hosted model can chew through before a human radiologist has even opened the file. That's the strategic piece nobody flags loudly enough in the day-to-day headlines. This is a story about who ends up owning the infrastructure the rest of the world eventually has to plug into. The underlying models, the training data pulled from hundreds of millions of patient encounters, the entire deployment playbook for rolling AI into a hospital safely, all of it built and stress-tested, first at a scale nobody else on Earth has attempted yet. Health ministries in other countries tend to end up calling whichever lab already wrote that playbook first, and that playbook is about to matter to a lot more people than just Chinese patients. The World Health Organization has projected a global shortfall of roughly 11 million health workers by 2030, with the gap hitting hardest in exactly the countries that can least afford to train new doctors fast enough to close it. A radiologist shortage in one country and a pathologist shortage in another do not care about borders. They care about whether a hospital can get a scan read accurately and quickly by whatever means available. A country that has already proven it can plug a verified diagnostic model into hundreds of hospitals inside 2 months. Is a country other health ministries are going to call first when their own shortage gets bad enough, whether or not that makes anyone outside China comfortable. It's a blunt trade a lot of health ministries will eventually have to make. Import a system trained mostly on someone else's population and adapt it locally, or wait years for enough new doctors to graduate that the shortage closes on its own. History suggests most countries reach for the tool that's ready now. Now, before this turns into another breathless China wins everything video, the honest version of this story has some real caveats baked into it, and they matter more than the highlight reel does. Every one of these systems learned its patterns from the patients it was trained on, and China's largest hospital datasets skew heavily toward urban, ethnically Han Chinese populations, simply because that's where the biggest, most digitized hospitals sit. When researchers have tested these same tools against rural patients or against ethnic minority groups underrepresented in that training data, accuracy consistently drops. A model that's nearly perfect, reading a scan from a major city hospital in Shanghai, is not automatically nearly perfect reading a scan from a rural clinic 500 miles away, and pretending otherwise is exactly how a promising tool ends up hurting the patients least equipped to catch its mistakes before they matter. It's the same gap China's own health ministry has spent a decade trying to close between its coastal cities and its interior provinces, and a model trained mostly on coastal data risks quietly reopening it. It's worth asking whether scaling AI diagnostics before closing that data gap risks exporting the exact inequality the technology was supposed to fix, just wearing a faster, more convincing mask. There's a sharper warning sitting right inside the DeepSeek rollout, too. Chinese researchers themselves, publishing in the medical journal JAMA, flagged that DeepSeek can generate answers that sound completely plausible and are factually wrong, describing the danger in stark terms as carrying substantial clinical risk. Picture a model confidently describing a drug interaction that doesn't exist, phrased with the same calm confidence it uses for a correct answer, and a rushed clinician trusting the tone instead of double-checking the source. Every large language model deployed anywhere in medicine right now carries some version of that same hallucination risk. A 2025 review even found that roughly a third of published studies testing LLMs as patient-facing chatbots failed to build patient safety into their evaluation at all. None of the researchers behind these tools are pretending the hallucination problem gets solved by better prompting or a bigger model. It gets solved, if it ever fully does, by keeping a trained human in the loop long after the AI stops being the bottleneck, which is the opposite of the fully automated future the scarier headlines keep promising. That's exactly why every single one of these tools, from Panda to the Agent Hospital to DeepSeek's hospital deployments, still runs with a licensed human physician, signing off on the final call before anything reaches a patient. None of this is a fully autonomous AI doctor quietly replacing a human one behind the scenes. It's a very fast, very well-trained assistant, catching things a tired human eye might miss on the 400th scan of a long shift, and occasionally getting something wrong along the way that a careful physician still has to catch. So no, there isn't one single AI system that outperforms every doctor on Earth. That headline oversells what's actually happening, and a story this good doesn't need the exaggeration to land. What actually happened is a small, growing list of specific AI systems beating specific human specialists at specific jobs, verified in journals nobody serious can dismiss, deployed faster and wider than anywhere else on the planet, and built by a country most people outside it never expected to lead in medicine at all. Every single one of those systems was built to solve a technical problem: read the scan faster, catch the tumor earlier, cut the diagnostic wait from 13 minutes down to 2 seconds. But the same country running that rollout just aimed its AI labs at something emotional instead of technical, something that should unsettle you more than any diagnosis speed record: the fact that millions of people, especially the elderly, spend most of their day with nobody in the room and nobody checking in. China just unveiled a new generation of AI robots, built specifically to sit with the people who don't have anyone else to sit with them. And what they're actually capable of goes a lot further than a diagnostic screen ever could.